cardiac catheterization laboratory, often called in short as cathlab, is the procedure room where invasive cardiac procedures are done. That could be coronary angiography, right and left heart catheterization, angioplasty, valvuloplasty, and valve implantations like transcatheter aortic valve implantation, electrophysiology studies, radiofrequency catheter ablation, implantation of cardiac implantable electronic devices like pacemaker. Cardiac cath lab involves ionizing radiation given by an X-ray tube and detected by an image intensifier. This is a flat panel image intensifier which detects the X-rays given out from the X-ray tube. X-ray tube is behind this lead shield. This lead shield is for protection of the operator. This is a lead glass for protection of the operator, which can be positioned according to the need of the operator when person shifts this way or that way. These two are provided for operator only because operator has maximum risk of radiation. There are other protective measures. The wall will be with radiation protection material, and windows looking into the cath lab will be made of lead glass to prevent radiation exposure to persons outside. Then each and every individual entering the cath lab during procedure will wear lead apron or titanium apron, which is supposed to be of less weight, and other protective devices like lead goggles, thyroid shield, cap, and so many things. So the principle is ALARA, A-L-A-R-A, as low as reasonably achievable for radiation protection. Then the other equipment seen here is, I told you the image intensifier is here and the X-ray source is here. These two together are mounted on a C-arm. This is the C-arm, which can be rotated in two planes depending on the view needed for angiography or intervention. Then this can be shifted this way or that way. And there are railings also. These are rails on the roof for mounting these devices. This can run on the rail. The patient table also can be moved this way and that way. That is for positioning during puncture, and after puncture for the procedure you need to move the table. That is known as panning. Panning can be done by the operator if the lock here is released. Otherwise, it can be done by the technician located here, who also operates this console. This is the console. This is the foot switch for operator. One is for simple fluoro imaging, the other is for cine imaging. When cine imaging is used, higher radiation will be given for better clarity. That is for angiography. The other one is just for viewing. And when the cine is pressed, there will be a different audible alert. These are arrays of monitors. There could be more also. One will monitor live fluoro. Second will monitor roadmap if needed, that is previous frozen frame. And third will be hemodynamic monitor with pressure tracing, ECG, everything for monitoring the status of the heart during the procedure. Suppose there is bradycardia, it can be seen, hypotension, everything will be seen on this monitor. In case of electrophysiology lab, there may be additional monitors for more detailed electrophysiology tracings. In electrophysiology cases, there will be other equipment like programmed stimulator, ablator, which are not shown here. This is only a basic cath lab. Then this is a pressure injector used to give injections into arterial or ventricular chambers, because arterial pressure is high, so you need to overcome it by a pressure injector, and it will be also timed. That is, it can deliver so much volume in so much seconds. That can be set. That is pressure injector. Coronary angiography is usually done with hand injection, while ventriculography, aortography will be done by pressure injectors. Then this is a spotlight over here, spotlight. That is meant for focusing on to the procedure region, like femoral puncture or cut down, whatever you are doing directly, not through the catheter. Something which is done through the catheter does not need a spotlight. That will be seen only in the monitor. It is remotely seen. So these are the basic equipments. Then in addition, there will be several racks for catheters, resuscitation tray, defibrillator monitor, everything. Additional protective equipment also will be there in the cath lab to cater to emergencies. Then when you are doing certain procedures, you will need bedside echocardiography. Portable echocardiograph can be available. Sometimes some procedures are done under transesophageal echo guidance by putting the probe in the esophagus. In that case, machine with echo probe will be shifted to the lab, or some labs with routine procedures may have additional equipment within the lab itself. So there's a wide range of equipments which can be there in a cath lab. This is only a basic system which is shown in this image.